Probably already guessed, portions of today's programming on this Miller Media Group radio station were pre recorded and are mechanically or digitally reproduced. There. Now we've made the attorneys happy. Thanks again for listening to this Miller Media Group station.
Your friend in Central Illinois, WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. My guest on the phone this morning is Tony Kirkman. He's the executive director of the Piatt County Mental Health Center. And by the way, the morning show streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin insurance agent in Clinton. Good morning, Tony. How are you?
Doing well, sir. How are you?
I'm doing okay. Like I said before we got started, I hope you can hear me okay this morning. I feel like I'm not projecting much volume at this point, so it's kind of disappointing. But anyways, Tony, let's dive into you and I were catching up before we got started a little bit. You are hoping to bring a program that has had some success in Piatt County and introduce it in DeWitt County. Tell us what you have going on. What are you hoping to do here?
Yeah, so it couldn't be good social work unless we had a lot of acronyms. So I'll try to keep them to a minimum. But so a branch of the Department of Mental Health, which is, Department of Human Services, is the Substance Use Prevention and Recovery Program. Interestingly enough, it spells super, so you can make your cheesy jokes if you need to. But the super program has really leaned into trying to resource those in the recovery community that are on the spectrum of recovery of 1 day clean to 30, 40 years sober, and trying to figure out how they can put additional supports in place. Mm-hmm. So one of the programs that they have developed is called the Recovery-Oriented System of Care, mm-hmm. Or ROSC. And the topic of ROSC is, again, just exactly that, breaking down stigmas of substance use and framing it more in the mindset properly of where it should be as an addiction, not a character flaw or an issue of morality. But really a chemical addiction. So breaking down the stigma of addiction, increasing opportunities for people to access treatment, whether that's inpatient, outpatient, or just some simple recovery support services, as well as creating opportunities for the recovery or sober community to have recreational activities that refrain from having the presence of alcohol or illegal substances around. It seems like many of the adult opportunities for us to congregate normally have either alcohol or something else that possibly would be unhealthy. So mm-hmm. the ROSC program is exactly that. It's a little bit different than what we remember from the AA 12-step program, where it's like, you go to a private room, you share your private walk of addiction, and it's all covered in this blanket of confidentiality. ROSC really means we need to celebrate people that have freed themselves from addiction and breaking the stigma so that those that are fresh in recovery can see hope, can see support of people that have made it through to the other side. Mm-hmm, so mm-hmm. All that to be said. Oh, go ahead.
I was just saying, it just has a more personal approach as well, it feels like.
Yeah, it humanizes it. Yeah. Instead of mm-hmm. saying those people, the reality is that if we're looking at stats, they say that there's somewhere around 20% of U.S. adults that struggles with a mental health issue, a diagnosable mental health issue. And many of the individuals that are in the recovery community, 50% of them have a co-occurring mental health issue. So, as a therapist, it's always interesting to me, is this person addicted to a certain illegal substance, or is there a co-occurring mental health disorder that they are treating through self-medication? And that's, not everybody. Some people, it really is just the disease of addiction. Mm-hmm. So we launched that program about a year and a half ago here in Piatt County. And one of the initiatives is to form a council. And the council has a whole bunch of different subsectors in it, from law enforcement, those in the judicial system, those in the health systems, recovery support, prevention, treatment, business sector. And so people with lived experience. And so this is what I love is you have people that are fresh in recovery sitting down with the county sheriff, sitting down with the state's attorney, sitting down with the medical community. We had an encounter just a couple months ago about verbiage of what do you use as far as in language? And some people with lived experience said that we need to keep using that people-centered language of, a person with an addiction issue or a person in recovery. And there were other people that said, no, you need to use stronger language like addict, like that's who I am. And we need to not be handling that with velvet gloves. We need to be real, because if people don't address their issues, they could die. And so it's those interesting conversations of how do we engage this community? How can we better resource it? That's one of the ways that we were able to become a drug overdose prevention program and be able to get the naloxone or Narcan to everywhere. And Seth, I got to tell you, I'm so impressed with the community's response. After we get through February, we will have visited and provided either naloxone or Narcan training to every single school district in Piatt and DeWitt County and many of the first responders. And so the idea is we're not condoning usage, but we're also not going to sit back and be reactive about it. We're going to be proactive and hopefully preventative and say, we have the resources in the community. In the unfortunate case that an overdose situation presents ourselves, our community will be resourced.
Now, again, I guess it's Tony Kirkman, the Executive Director of the Piatt County Mental Health Center. So, Tony, if I'm not mistaken, this was a grant that you received for the ROSC program. Did that have like a contingency of, okay, you get the grant for like 3 years and then you need to basically take up the program on your own from a financial perspective? Is that how that worked?
You're right. There is an expectation of sustainability because the government doesn't want communities to become dependent upon state dollars. What they're trying to do is to rally a community to say, recovery is important. It should be important to your community. And if it's important to your community, you should invest into it. So yeah, there is an expectation that it will be self-sustaining. There's some conversations at the state level of saying, well, do we kill a program if it's having good results just because of something as simple as money? So I think the state's still trying to play around with that of saying the expectation is for you to be sustainable, but we're not going to take resources from the community. So where's that balance? One of the interesting things for us is, and I've got to give a huge shout out to the DeWitt Mental Health Board, that they are also being proactive, is they have allowed us a little bit of seed money to go into the communities of DeWitt County starting in the beginning of this next calendar year to start talking to DeWitt County individuals about ROSC and what it can do, how it can resource people. How do we get community champions and partners in place? Because I'm really hopeful that we will not only be, I know we will apply, I am very hopeful that we will be accepted to bring ROSC to the communities of DeWitt County.
Yeah, definitely. Now, for those out there wondering, Tony, what does this kind of look like on a more micro level? Maybe whether it's day to day, week to week, month to month. Do you mind laying that out for us? Like, what does it look like more specifically for folks that participate?
Yeah. So we hired a ROSC coordinator for Piatt County. And so on a kind of a week to week, her day fluctuates between either talking with community partners of how we can supply them with naloxone, how we can use person-centered language, how we can get resource cards, into their facility that they are comfortable with. So, for example, the Illinois Helpline for individuals that are struggling with substance use, just putting resource cards. One of the other things that she does is that over here at Piatt, Kirby Medical Center has a Suboxone program, which is a medicated assisted recovery program, helping people with opioid use disorder come off of chemical dependency through the use of a medicated assisted treatment. So she comes alongside those individuals and provides case management support. So checking in on them, holding them accountable for some of their appointments, resume building skills, job development, getting community messaging out via billboards or social media. And then, of course, running our monthly ROSC Council and ensuring that we have a good representation of people with lived experience, because that's what drives this program. It's not everybody that has all the funky alphabet soup behind their name talking about those people and what those people need. It is the people with lived experience speaking to the community leaders and the treatment providers saying, you need to open up these doors and you need to listen to us because we know what we need.
Mm-hmm. And that's what kind of, for me, makes it more personal. You know what I mean? Like you said, it's people with that lived experience, advocating and connecting, if you will.
Yeah, absolutely. I can tell you what addiction looks like, but because I've seen it in a textbook, and I can tell you treatment models and all of that. But if you are looking for a way out, you would much rather want to talk to a guide that's been there.
Mm-hmm. Tony, what do you have to do to make this happen in DeWitt County? You talked about the collaboration with the 708 board. Anything else you need to do to make this happen in DeWitt County?
Yeah, well, I need community partners. I need to come over there and identify somebody with lived experience that might even be interested in coming on board with us to be our ROSC coordinator. The first couple of steps is I need to get letters of support from law enforcement, school officials. I already have a commitment from the Piatt County Health Department. And so it's talking to some of these individuals. My hope is that we had a really, really great DeWitt County substance use coalition. And, the leaders of that coalition did such a wonderful job of pouring themselves and their talents into it. But the reality was those leaders had their actual work commitments too. So what it needed was a champion that was their full-time passion and their full-time job. I think we can bring it to DeWitt County. I think we have some good bones there. And obviously, just like Piatt County, the need for those in recovery to have someone support them and see them and resource them is extremely important.
Very good. Well, Tony, we look forward to how this comes about. Do you have a timeline on when you hope to get this thing going in DeWitt County?
Yeah. So, like I said, initial emails and luncheons and conversations should probably start at the top of the calendar year. I have to have a packet in place by the end of February for a submittal. And if accepted, we hit the ground running hard July 1st with council meetings, communication campaigns, and we're off to the races.
Tony, let's take a time out here, my friend. Where do folks go to learn more about the Piatt County Mental Health Center?
Yes, visit us online, piattmhc.org. Check us out on Facebook or give me a call at 217-762-5371.
Tony Kirkman is the executive director of the Piatt County Mental Health Center. My guest on the phone here for this morning. More to come with him on the WHOW Morning Show.
WHOW.
Despite supply chain issues, owner Dave Jackson's great team of employees at your Clinton Save-A-Lot are working to keep their shelves stocked to save you up to 40% every day. Find out more by clicking their icon at DeWittDailyNews.com.
Peterson Insurance Services in Clinton is a 2014 Pekin Insurance Illinois Agency of the Year. Jay Peterson here from Peterson Insurance. Find out about Pekin's auto, home, or life insurance by clicking on our icon at DeWittDailyNews.com.
Liberty Village, located at 1 Park Lane, west in Clinton, pauses from all the hustle and bustle of the season to thank its many customers and friends for their patronage this past year and wish you and your family a very Merry Christmas. It's their sincere wish that you celebrate the holidays with the ones you love and that the new year will be full of health, happiness, and prosperity. Merry Christmas and Happy New Year to you from the management and staff at Liberty Village, located at 1 Park Lane, west in Clinton.
The most stressful part about being a farmer is the uncertainty of everything. Knowing where your margins are, knowing where you need to be able to be profitable to continue on for years to come.
You have to make the numbers work, but commodity fertilizer blends don't add up. They don't offer the larger profit potential that Micro Essentials does, with higher yields annually proven over 15 years. Micro Essentials from Mosaic, the science of more.
The WHOW Morning Show is now video streamed live on the WHOW WEZC DeWittDailyNews.com Facebook page and on the new WHOW TV YouTube channel. Watch Morning Show host Seth Lawrence interview guests live, as well as watch archived video podcasts of any interview you missed. Whether on Facebook or YouTube, we're providing 2 more ways that Central Illinois' local news station, WHOW, delivers compelling content for you.
Your friend in Central Illinois, WHOW.
Once again, a good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Piatt insurance agent in Clinton. Tony Kirkman is the executive director of the Piatt County Mental Health Center, my guest on the phone for this morning. And, you know, Tony, I don't know, we've talked in recent visits about the Illinois Youth Survey and the data that has come of that. I don't know if you have had a chance to look at that as it relates to youth and mental health, or if your counselor that's in the Piatt County schools has talked to you much about what she's seeing lately. But anything stand out to you as we think about our kids and their mental health and wellness? How about that?
Well, I would say, sadly, I'd like to see our numbers much lower than what they are. We're still hovering right around that 30% rate of 10th and 12th graders that have stated they have had significant thoughts of wanting to harm themselves in the past year. One of the things that I am very thankful for is that obviously we are engaged with our school systems through a myriad of different programs of support behavioral health wise, prevention wise. But I also want to say to your listeners over in DeWitt County, you have a fantastic behavioral health program and Heritage Behavioral Health. Jessica and Corey over there are really looking at this data closely and talking with some of the school leaders over in the Blue Ridge District and over at Clinton. Katie Arnold is fantastic over there. So you have a lot of really skilled people that are trying to address this issue. I think I told you before, there was a mental health professional I talked to at the state level that believes that the effects of COVID are going to cost us at least 7 years of deprogramming, reprogramming. We took everything from social outlets, natural transitions of prom, homecoming, graduation, the social isolation, and just the unknown, the unpredictability of everything, cause anxiety to increase threefold. And we're still seeing that. I'll give you an example, Seth, and I know it's not really teen related, but so our intake worker who sees most of the people expressing interest in behavioral health, she said we were averaging somewhere around 35 calls. She went to lunch one day, and when she returned, she had 5 voicemails from people seeking counseling.
Wow.
Yeah. So the need is there. And one of the things that you keep hearing is the need for behavioral health professionals in the workforce. And my concern of kind of looking 5-10 years down the road is we're going to rush and try to get all of these workers pushed out into service fields, but we're failing to tell them how to take care of themselves. So what ends up happening? We just send a whole bunch of workers to burn out in 4 or 5 years.
Interesting stuff. Tony, as I look at the clock, we've got about a minute left here this morning. Any final thoughts on that topic or any others as we hit the holidays here?
Yeah. So what I would say is holidays are wonderful for some people, and it's a sad reminder for others. If any of your listeners are experiencing a mental health crisis, please do not forget Heritage Behavioral Health has their crisis line set up. But if you can't remember that number, there is a national lifeline. It's called a suicide and lifeline. It's 988. All you got to do is dial 988 and you are connected to a phone bank of trained counselors that can sit and talk with you. They're well skilled. And if it requires an in-person visit, they can dispatch professionals for you. Please reach out. We are here to help.
Tony, it's always good to talk to you, my man. Happy holidays to you and yours, and we'll catch up on the other side of the new year.
Sounds great, Seth. Happy holidays.
That sounds good. Tony Kirkman, Executive Director of the Piatt County Mental Health Center, my guest on the phone. Network news next. We stream to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin insurance agent in Clinton.
WHOW.
With SRN News,